So the kinesio taping is a cotton fiber come longitudinal stretch tape that adheres lightly to the skin and applies the pressure to the tissues and elevate the skin with arm movement to reroute the lymphatic flows and other lymph nodes that are not affected, and which also aids in decreasing BCRL and among the patients undergoing axillary dissection. So coming to the CDT therapy, it is a non-invasive treatment for breast cancer survivors like secondary to axillary dissection, which includes the 4 golden standard treatments: manual lymphatic drain, application for 45 minutes, and application of short stretch bandage, multi-layer bandage compression, and exercises to be performed along with the application of bandages and skin care. The axillary dissection patients for breast cancer, the standard surgical procedure for extracting lymph nodes for staging the treatment and metastatic breast cancer. So the lymphedema, abnormal accumulation of fluid, protein and water into the interstitial space, which causes lymphatic system because of mechanical insufficiency. So the CDT therapy, which has like manual lymphatic drainage, need to be performed to the patients and rerouting the lymphatic fluid from affected area to unaffected area to enhance the reabsorption of lymphatic fluids in the healthy nodes. Then second step is application of short stretch multi-layer bandages, and which take a duration of 10 to 15 minutes, and the patient will be staying with the bandages for 22 hours in a day. Then the patient used to perform exercises and continue with the skin care. So the 4 golden standard treatment along the CDT therapy, which includes. And the treatment of CDT therapy to be continued for 20 to 24 times of applications. Then intervention, the kinesio tape, which composed of 100% of cotton fiber, acrylic heat sensitive glue, and kinesio taping had been designed to allow 30 to 40% of longitudinal stretch, and KT applied twice a week for the interventional group. So the short stretch multi-layer compression bandage working with the principles of high working with low resting pressure. So the approach and this methodological approach, we have used quantitative research approach on randomized clinical trial and setting the Department of General Surgery as well as the patient seeking treatment from Department of Surgical Oncology of AIIMS Bhubaneswar. And sampling method is probably sampling method, and sampling technique computer based random number generator and SNOS method. Sequentially numbered opaque seal envelope method was used. The next sample size was estimated based on the study Ivana Malika et al. And 2014. Study on kinesiology taping reduces lymphedema of upper extremity in women after breast cancer treatment. And the formula also estimated with achieving 80% of power analysis with level of 5% significance of equal allocations were made. The estimated sample size was 40, so it was equally divided into experimental group and control group. But in this study we have screened around more than 76 patients. So inclusion criteria, female more than 18 years of age were a part of the study, and history of axillary dissection for CA breast with or without chemo or radiation therapy, and unilateral grade stage 1 and stage 2 degree lymphedema upper arm patients were recruited, and circumferential measurements it's less than 2 cm between affected as well as unaffected arm. Exclusion criteria, history of upper arm lymphedema before surgery, unable to participate in the intensive phase and treatment regularly, and patient who had developed primary arm lymphedema are excluded from this study, and developed upper arm lymphedema due to axillary metastasis as well as recurrence were excluded. Then upper limb cellulitis, the patient who has reported upper limb cellulitis as well as DVT, and undergoing pneumatic compressive treatment also excluded from this study. So ethical consideration, so IEC approval we have obtained from IEC AIIMS Bhubaneswar with the reference number, and IRC permanent project code also obtained because it is a funded project by AIIMS Bhubaneswar. Then we also simultaneously registered CTRI registration. So the consult guidelines were followed in this study. The patients were allocated as per the consultative report checklist. So data collection process, so the study has 2 phases, intensive phase as well as maintenance phase. So intensive phase, the patients were recruited and their demographic profile treatments were obtained, and clinical parameters and treatment profiles also as considered. Then assessment parameters, 8 levels of arm measurements were taken just in the 0 day of a patient's visit, and then the treatment were continued on a routinely for 20 to 24 applications. Then limb of quality life scale also used to assess the effectiveness of treatment and the patient's comfort pre and post treatment. And the measurements were obtained 0 day, the day the patients were recruited for the study after checking their inclusion and exclusion criteria. Then treatments were initiated. Then next followed by 15th day the measurement was obtained. Then 30th day as well as the 60th day. So the arm measurements, circumferential measurements were mentioned here. So the treatment will continue. When the patients were successfully completing their intensive phase treatment, we move on to the maintenance phase. It's considered as a rehabilitative phase. So rehabilitative phase, the patient has to move on to the self-bandaging technique, whereas the digital education were provided to the patient by self-bandaging technique on short stretch multi-layer bandages, which was in the website of AIIMS Bhubaneswar in language of Odia. Then self-MRT techniques were taught to the patient and exercises. Then education care of short stretch multi-layer bandage and compressive garments also given to the patients. The results were really effective. So intervention group who had undergone kinesio taping versus complete decongestive therapy. So they had a mean difference between the prior and after treatment is 20.90 centimeter difference. And with one-way repeated ANOVA T measures test were used, which shows that 29.29 with level of significance is 0.001, and with CDT group, non-experimental group has a difference of 9.30. Then next is about CDT versus with right upper arm. The findings are also again more significant with F findings of 17.38 and with level of significance of 0.01. And in the control group, which has a difference of 2.76. So the quality of life also significantly improved, and quality of life also improved in the intervention group, which has an left arm patients who are applied for bandages as well as the right arm. So the T level of 3.17. So the outcome measures, the primary related to primary objective, the reduction of edema in upper arm circumstances were noted. Then the patients can able to resume their activities of daily living without any other issues. So outcome measures, improvement in quality of life, and we have created a self-help group also for the patients, whereas within the WhatsApp group, the patients as well as like other survivors also in, and they can able to share their experiences or any query related to their services also can be provided. So the recommendations, it's nurse-led clinics can be recommended for long-term care. The benefits of kinesio taping and CDT, lower extremity and trunk lymphedema can be prevented out of. The next is the study can be replicated. Then larger and multi-centric trials can be done, and that integrate kinesio taping and standards of CDT regimens. The limitations are it's a small size and single-centric studies. So coming to the conclusion of this, kinesio taping and CDT represents promising approach to management of lymphedema, offering greater improvements in swelling of reductions without complications of patients and dropout. The combination therapy could enhance the quality of life for patients suffering from their chronic conditions by providing most effective and sustainable relief. So, thank you. So, any queries and clarifications? No, sir. Sir, because the vendors only supplied, and it is supplied us from AIIMS Delhi, and we are in the government organization, we are not promoting. Sir, it is available in the market, even Amazon. Any queries from delegates or dignitaries, please?
Thank you, ma'am.